After you get done, please. Thank you.
So it's each set. I have 14 here. Maybe some people can share.
Okay. So one of each stack?
Yeah, one of each stack. Yeah.
Oh, okay.
Thank you, Mr. Chair. If you don't mind, I will let Representative Potenza.
I mean, if Representative Potenza wishes to join you, that's fine.
Is that your stuff? Yeah. Oh, okay. That's it for.
This is
Just one of each?
it's a set.
Okay.
It's a set. Hey, you can.
Yeah, thank you. Thank you, Mr. Chair. Just for the record, Representative Kelly Potenza, Stratford District 19. So I'm just going to say good afternoon, and Mr. Chair, and thank you, members of the committee. I really like the opportunity to be able to speak today on an issue that's very important to me and a lot of constituents. And it really lies at the intersection of public health, personal freedom, and frankly, common sense, which is making ivermectin available over the counter. For decades, ivermectin has been a well-known, well-studied antiparasitic medication. It earned its discoverers the Nobel Prize in Physiology and Medicine in 2015, which that's the first document that I gave all of you. And that was due to, of course, its global impact in treating diseases like river blindness, lymphatic, filariasis. And in fact, the World Health Organization, of course, listed ivermectin as an essential medicine. And the U.S. Centers for Disease Control and Prevention includes it in its treatment guidelines for strong gliodiasis and other parasitic diseases. So ivermectin has actually been administered over 4 billion times around the world and has an excellent safety profile. Yet, here in New Hampshire, after passing this bill in 2022, only to be met by a veto from the governor at the time, access to ivermectin remains unnecessarily restricted. Despite its long history of safe usage, patients must navigate prescription requirements and bureaucracy just to access a drug like, in most all cases, carries a much lower risk than over-the-counter pain relievers like Tylenol. So the question is simple: why? Why should a drug with decades-long track record of safety and effectiveness not be available without a prescription, especially when many far riskier substances are? Making ivermectin available over the counter would empower individuals to manage their own health more efficiently. It would also reduce the burden on healthcare providers, freeing up resources for more complex medical issues. For anyone dealing with parasitic infections and autoimmune issues, the ability to walk into a pharmacy and purchase proven, affordable medication should be a basic convenience, not a legal obstacle. Some might argue that misuse is a risk. Well, that's actually true of any medication. But restricting access due to hypothetical misuse is a poor substitute for education and responsible guidance. By providing clear usage instructions and public health information, we can equip people to use ivermectin safely, just as we do with antihistamines, antacids, and actually even insulin in some countries. We trust individuals every day with the responsibility of managing their own well-being. It's time we do the same with ivermectin. Let's bring policy in line with science, history, and common sense. I urge this committee to look at the hard evidence and then to take the right step forward. Let's give people the access they deserve, and let's make ivermectin available over the counter. So I just wanted to give just a couple, facts that are kind of really important at this So I know ivermectin really became on everybody's radar during COVID, and I do have COVID documents that are in there, but I didn't want this to be focused on that, only because, you know, I was very familiar with ivermectin because I have a very good friend that suffers from tick-borne diseases and has for the last about 20 years. She's been taking ivermectin daily for that amount of time. Her entire family never had experienced anything that had to do with COVID or any of that, and it was just kind of a nice added benefit that was giving her an extra layer of protection even during that time when she already has autoimmune issues. We already have in the United States 2 states right now that allow ivermectin to be sold over the counter, and there's a whole slew of other legislation that's going through right now. So we've got Idaho that that legislation passed both chambers. Idaho's actually that's right now. The 2 that are legal are Tennessee and Arkansas. Tennessee has been legal for 3 years. Arkansas just passed. Idaho just passed both chambers, and the bill is on the governor's desk, waiting for Brad Little's signature. So Louisiana, West Virginia, Kansas, South Carolina, and Pennsylvania is very close at this point too. But I just would love to talk about all of the other countries that have ivermectin over the counter and have had that for a long time. Mexico's a great example, but when COVID hit in 2020, 8 Latin American countries immediately rushed to distribute mass quantities of what they called COVID kits. And it had a whole bunch of stuff in it. But of course, one of the biggest things that was in there was ivermectin. And so it was like Brazil, Honduras, Panama, Peru, Bolivia, El Salvador, Guatemala. And then, so that was all happening. Australia, for example, so in the 1st of June in 2023, this is pretty important as well, they were very, very strict on COVID protocol. So they actually, prescribing of oral ivermectin for off-label uses will no longer be limited to specialists such as dermatologists, gastroenterologists, and infectious disease specialists. So that they made a final decision to be able to open that up as well in Australia. A very well-known, his name is Dr. Miller. He's American Board of Emergency Medicine. He's actually an inventor of this it's called the EZIO. It's a medical device used for intraosseosis. It basically delivers medications and fluids directly into bone marrow. He was an author. He was the chairman for 5 Baptist ERs for over 10 years. He treated over 130,000 ER patients. He got ranked Humanitarian of the Year in 2017. WSJ Award, Invention of the Year in 2008 and 2012. So he actually is currently on a missionary in El Salvador working with a whole slew of different medical patients. So this is his quote: "I used ivermectin to successfully treat over 1,000 COVID patients without losing one. I was banned from all social media for spreading information. I lost many friends and credibility, but the president of El Salvador praised me. And now we've come full circle, and all of these things have come to light." There was a lot of things that were just misinformation, of course, during COVID, but let's just talk about the safety protocol alone for ivermectin, okay? It was approved for human use in 1987. Like I said, it's been administered over 4 billion times around the world. It's on the list of the WHO's essential medications, won that Nobel Prize. The most important thing is it's not considered toxic at all to liver and kidneys and lungs, which, you know, ibuprofen, Tylenol is. It's got no adverse effects in using ivermectin to treat COVID and other things. They're now looking at it, of course, for other autoimmune diseases, rosacea, and cancer. We've got so many studies. There is a document that I gave you, which is, so here's just some great stats for COVID. But this second page is actually the beginning document for 74-page document that shows you all of the studies that have been done and gives you kind of a briefing of it. I wasn't going to print that out for the committee, but I will be happy to follow up and give you these things in nice little links or attachments to your email afterwards, because I just think it's important to have that. One of the biggest things is it doesn't cross the blood-brain barrier. And there are over-the-counter medications right now that do, and that's very dangerous. It gets metabolized by the liver. So I can go on and on about all of these wonderful things that when it comes to ivermectin. And
We appreciate all the information you've given us.
yeah, and I will end with the other, the documents that are here. This one is basically ivermectin, a multifaceted drug with a potential beyond antiparasitic therapy. That's very important to read. The abstract, that paragraph is fantastic. It talks about its anti-inflammatory, antiviral, anti-cancer properties. I told you about the Nobel Peace Prize. And this one is really the starting of ivermectin. So it was because the drug was discovered in the late 1970s. It was actually called Ivermectin before it was ivermectin. And the beautiful part about this is it talks about how it was used. And the topic of it is Ivermectin Wonder Drug from Japan, the human use perspective. This is a fantastic article if you have the time and you're interested in reading it. But I'll open it up for questions. That's it.
Thank you, Representative McLean.
Thank you, Mr. Chair. Thank you for taking my question. So let's take COVID out of it. Let's just go back to 2015 in a time machine. Many drugs that are safe are over the counter, but many drugs that are safe are also you need a prescription for. So, and with your friend who had a tick-borne illness, she used it for a very long period of time. Do you know why it was in 2015, pre-COVID, all this stuff, that Tylenol was deemed safe to be over the counter, but ivermectin at that time was deemed to not be safe for over the counter and had to have a prescription?
It was never over the counter, from what I know, in the United States. So I don't have any background of that. I do know that it was very easy for her to get ivermectin and for pretty much anyone to get ivermectin at that point. So that was 2015. Moving forward, this really all started in 2020 when there were studies that had been done previously showing that it would stop like the viral replication if you're taking it early, the cytokine storm, those types of things. But it was never over the counter here in. It's cheap. It can be produced. There's a lot of pharmaceutical companies want kind of control of that too. But if you look at all of these other countries, it's, when my mom went to Mexico 3 years ago, she's like, oh, they sell right there at the kind of like at the market. So it's just a very common thing versus, of course, here. So.
Other questions? Representative McGrath.
Thank you, Mr. Chair. Thanks for taking my question. I just want to say in like 40 years of pharmacy, I probably dispensed ivermectin less than 10 times. It's just wasn't something that was used widely. I do want to add to your testimony, though, in 2020, when the government and the news media were saying how dangerous it was, the two biggest medical journals in the world, the Lancet and the New England Journal of Medicine, published articles about how dangerous it was, which they had since retracted. And
Remember, you're supposed to be asking a question.
Thank you. And they had since retracted it and said they were under pressure for for publishing it. So I guess my question is, why would they do that?
There's a lot of different reasons. Mainly it's money, it's power, it's control. I think everyone on this committee, it doesn't matter where you fall. You know, this isn't a partisan issue. We know that drug companies have a crazy amount of influence. The amount of safety that was done, I mean, they spread they gave this out freely, all these other countries, in a kit to say, hey, we're going to help you out during COVID. It was crazy. They already knew the safety protocol. So for that propaganda and frankly, those lies to happen, it's a lot of it has to do with big pharma and controlling all of that. I was very, very upset for a long time. The reason why I ran for, to be a state rep was because of the stuff that took place during COVID and a couple other reasons, and I was really upset about it. So this Ivermectin, I started researching, right in 2020, and I was just blown away. Like you had the CDC that basically put out an image that said, of a horse, and it was just incredible when people had been taking ivermectin for multi-use different things for decades. And, it's really hard. And there was a lot of that stuff that was going on. So I'm really glad where we are. It's 2025 and all of that misinformation is behind us. I love that I have a document that shows, that it was called a wonder drug all the way back into the 1970s. So, I'm hoping that New Hampshire can do this just along with all the other states and all the other countries.
Would you believe that I knew of several people during COVID that were heading down a very dangerous path towards hospitalization that stopped the minute they started taking ivermectin?
Yes, I would believe that, and I'm very familiar with it. So, I'm going to give a personal story. So, our family, except for my husband, we got COVID, and this was early on. It wasn't bad. I, had no taste, no smell, so that was kind of the thing. I had called at the time, this was before everything got shut off, frontline doctors, and I talked to a doctor on the phone, so it was like telemedicine, and I received prescriptions for ivermectin and hydroxychloroquine, and then my husband went on hydroxychloroquine prophylactically, and he never got sick, and he stayed on that for a while. It's just kind of a force field around him, and I was better within 3 days, and it was, but the doctor from Arizona was very clear. She said, if you can get your hands on this and stock up for your family, make sure you do, because it's going to come down and they're going to stop all of this because it's just the nature of the beast. And in New Hampshire, I know that this isn't, hydroxychloroquine was through basically an executive order, the governor along with DHHS, they stopped that here in New Hampshire. And that is the reason why, if you look at other countries that take hydroxychloroquine is, kind of like you're taking aspirin, they didn't have any outbreaks of COVID. So we know better, we do better. This is amazing for people here in the state. This is enabling legislation, and I'm hoping that we can make it happen again. We already passed it once, 2022, so let's do it again.
Any other questions? Representative Markell.
Thank you, Mr. Chairman. Thank you for taking my question. Perhaps I overlooked it. Are there any surrounding states in New England that are taking the same course of action that you have, or is ivermectin available in any of in New England area?
Not in New England area. I had mentioned the ones that I was talking about that are working on, Northeast, right? If you consider Pennsylvania, they're they're getting very close to passing the legislation to make ivermectin over the counter. I should probably mention that this is on the radar of the federal government right now, so that's a good thing. But you know what? We're not going to worry about them. The states got to do their own thing first. I think it could happen on the federal side. That would be great. That makes it a lot easier for everyone else. But that's the closest one I would say.
Okay,
Thank you.
quick follow-up.
Thank you.
Are you aware of any pending legislation in New England that would duplicate what you'd like to do?
No, I'm not. I did talk to a state rep in Ohio, and they, we're all on different schedules, and so that's going to be coming there. They just passed another piece of health freedom legislation, so we're going to see a lot more of this, especially since Arkansas just passed theirs, which is great.
Okay, thank you.
Okay, Representative DeLamus.
Thank you, Mr. Chairman, and thank you for taking my question. Would you believe I've been administering ivermectin to horses since was 1981, and that ivermectin has been found to be safe across a spectrum of different animal species: cats, dogs, horses, humans. It's a universal drug and can be used safely across all of those parameters. So I'm very glad that you would take my question, and thank you for coming.
Yes, I'm very familiar with that. It's used in a wide spectrum in mammals, and it was amazing. So when it was first used in animals, they saw how, from testing, of course, with animal testing and all, they saw how safe it was. And then they're like, wow, this could be used for this, this, and this. And of course, some majorly debilitating diseases that are overseas. And that's when it started. And that's why, they've called it, that's why it won the Nobel Prize. That's why, but that was in 2015, I believe it won that. But we're talking about other countries that have been kind of yelling about this off the rooftops for a long time. So,
Anyone else? Okay, thank you.
Just to clarify, the last piece of paper is Amendment 1606 that will be introduced during executive session, just changing 2 words in the first paragraph. And Idaho actually just signed the bill into law yesterday, so now it's 3 states.
okay,
3 states so far?
3 states.
Do you have more copies of that amendment? Yeah, I thought it was the old one.
I thought it was 1498.
I've got the one.
He's bringing more.
Okay.
Yeah, and if you would like, I can give you, it's a long list of countries, dozens of countries that are over the counter, if you'd like that as well, so.
Thank you, Representative Potenza.
So this is the new one. Okay, I got it now. Thank you.
Okay, thank you, Representative Palazov. We need a pink card from you also. We do have one from Representative Potenza. Also signed up to speak is Jonathan Ballard, the Chief Health Officer for the Department of Health and Human Services.
Up to the chair. Okay.
What's that?
All of them in the order you want.
Well, I had already promised Chief Ballard. I think he's under a...
I'm sitting here.
Okay, you're next, Senator.
Okay.
Actually got 2. Mr. Williams had already filled out one for you, so we have 2 from you.
Well, thank you, sir. Certainly would give deference to Senator Gray to go
And
before me.
you said under 5 minutes, but if you can make it 3, that'd be great.
Absolutely, very short, sir. For the record, my name is Jonathan Ballard. I work as the Chief Medical Officer at the New Hampshire Department of Health and Human Services. I'm a family physician by training. The department does not take in a position on this bill and providing information only. So I wanted to remind the committee that this underlying bill has a savings to the state and was included in the governor's budget of at least $9 million. The second half of the bill deals with its own standing order for lab tests and over-the-counter medications could potentially provide much more savings beyond the $9 million that this underlying bill provides. Remind you again what a legend drug and a non-legend drug is. A legend drug is only those drugs that are prescribed with that need a prescription. And there was a question earlier that Representative McLean had about about why this drug is a prescription drug versus a non-legend drug, which is an over-the-counter medication. So that's determined by the FDA, and they determine that based on really two factors. One is the safety profile performed in studies, and then also the length of time and the post-marketing surveillance that is done on a medication. So the FDA makes that determination. Typically, it's not individual states that do that. For this bill, I just want to point out a few things in the language of it that you may want to pay particular attention to. I've seen this language presented in some other states in some areas that doesn't seem to be aligning potentially with New Hampshire. One aspect of it, it does not mention that anything about physician assistants. In New Hampshire, when physician assistants, this is legislation that you passed last year, reach a certain number of hours of education and patient encounters, that they have independent licensure. So that's not included in this language. So the reason why the drug is a prescription drug is that it's not been considered safe in pregnancy. So the effects on the unborn baby or the fetus has not been determined safe. It does pass through the breast milk, and it is not FDA indicated for any child less than 15 kilograms, which is 33 pounds. It does interact with liver and kidney diseases, and this is the reasons why the FDA makes it a prescription rather than over the counter. In New Hampshire, we have two cases where drugs are prescribed through a standing order. Both of those two cases are in emergency situations, one being naloxone or Narcan, and the other one is an EpiPen. So both of those are kind of emergency situations where it's life or death situation. This would be the first time in New Hampshire that it would not be a life or death situation, that a standing order for a prescription is actually effective in the state. If I may indulge, I have a few more just points.
A few seconds.
A few seconds, sure. Dosage is very important in prescribing this medication. The screening protocol doesn't mention anything about pregnancy tests, and also this bill doesn't say anything about the cost. It does mention that the individual can be charged. That's not allowable for Medicaid. You cannot charge any Medicaid client, so I would ask for that to be changed if it were to go through. And it doesn't talk about cost for, does Medicaid or insurers, are they required to pay for this medication? Are they also required to pay for the pregnancy test? And it doesn't mention anything about liability protections to the pharmacist should they be issuing this medication to an individual that doesn't fit the safety profile for the medication. So with that, I'll stop and take any questions. Lastly, it doesn't mention whether it's oral medication or topical medication. Topical medications used for head lice and lotions, topical creams. It's much safer profile versus the oral profile, which does have typically a diagnosis involved, where you proactively determine that the patient is the right person for that medication. I will stop.
Thank you, Representative Weber.
Thank you. Just for clarification, when you started, you spoke about a $9 million savings to the bill. That was the underlying bill, not this amendment. Is that correct?
That is correct. This amendment would cost money to the state with additional costs rather than...
Are there any estimates as to how much additional money?
I think it's indeterminate.
Okay, thank you.
Representative Kofal.
Thank you, Mr. Chairman. Thank you for taking my question. So, regarding your statement about standing orders applying to Narcan and
EpiPens.
So, are you aware of RSA 31847L, I believe?
I'm not.
Which authorizes the dispensing of hormonal contraceptives via standing order. So would that square with your statement, or would that be?
It does, because substantive that has actually gone over the counter federally. So that's sort of a moot point at this point.
Thank you.
Representative McLean.
So just to kind of get these comments back to the reason that it is classified when they did the studies as not over the counter but need a prescription is because it's not safe for pregnancy, pass through the breast milk, negative impact, so if you have kidney disease, and the dosage. So, I mean, if I look at my bottle of Tylenol, it says, okay, adults, this is your dosage. Children, this is your dosage. So that cannot be done with ivermectin, or it's much more complicated based on the use? Try to explain that.
No, that's a very good question, respectable. I think it's because you have to proactively determine that the patient is the right one to receive it versus, I don't know, I cannot fully answer your question, and I respect the question, but I think it's mainly because you have to take a proactive decision that this medication is needed for this patient versus an over-the-counter medication that's used for wide-ranging general conditions.
Thank you.
Anyone else? Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. So I listened to your testimony briefly there about how ivermectin specifically doesn't say in the bill about prescriptions or whatever it is for prescribing it, so Medicaid pays for it. So I'm guessing that Medicaid currently pays for ivermectin. That would be my first question.
Yes, we actually have 0 prior authorizations. So any provider who prescribes ivermectin for any condition, Medicaid will pay for it. It's such a rarely used medication. It's not something that's a high cost to the state as far as the Medicaid program for prescribed medications. And it can be prescribed for COVID, for anything, and the state Medicaid program will pay for it.
Okay, a follow-up.
Follow-up.
So I guess my follow-up question would be, if this were to pass, would drugs like Tylenol, I'm guessing, aren't covered under Medicaid because they'd be over the counter. So that would change that. Or was there any provision under current law that would still allow this drug to be prescribed, let's say even if it was over the counter, in Medicaid to cover it?
I think that raises an interesting question I have not considered.
Okay.
Okay, I'm seeing no other questions. Thank you. And now Senator Gray, please come forward. Thank you for your patience. I had received a text earlier in the afternoon asking.
Pay me so much money, I got it. Hello, my name is James Gray. I represent Senate District 6, which starts up in Alton and Gilmanton, comes down Route 11 to Rochester and Stratford. I'm not here for or against ivermectin. Okay, I went to the doctor's Monday, and on my way out, I says, "Hey, tell me about ivermectin." She started giving me stuff where she doesn't support it. I says, "Yes, but does it hurt anybody?" And she says, "In most cases, no," which is consistent with the testimony that you've had so far. It's that there could be cases where it is contraindicated. But that's not why I'm here. I talked to a pharmacist. I says, well, what about this? And the pharmacist says, well, the way that this bill is written, there are problems. Okay? Fine. Whatever. What I'm here is in support of the base bill. Okay? The estimate that I have is the original bill is the $9 million plus the other things that he talked about, and I've been given an estimate of $12 million. And as the chair of finance, I need the $12 million. Anything you put on this bill that might not get it passed takes away money that I can use for all of those things that you had to cut out of the budget to get a balanced budget. So, again, ivermectin, okay. No ivermectin, okay. I need $12 million. When I came here the first time, I told you, I usually go by the Hannaford brand, right? But when the brand, I've got a coupon and the name brand is cheaper, I go buy the name brand and use my coupon. That's what the underlying bill does. And it'll save the state approximately $12 million, and I need that $12 million.
Mr. Chair.
Okay. Representative Weber.
So am I right in thinking that what you're saying is that it would be wise for those people who support this initiative to file it as a standalone bill next term rather than attaching it to your $9 to $12 million?
I wouldn't go as far as you did, Representative. What I would say is that anything that puts the underlying bill in jeopardy, I'm not in favor of going on the bill.
Anyone else? Seeing no one. Thank you, Senator. Also signed up to speak is former Representative Jerry Kinnerk.
So for the record, former Representative Jerry Kinnerk, MD, and this amendment's the same as HB 1022 from 2022, and people who wanted to use ivermectin for the treatment of COVID. A lot of things are said about positive studies, but you have to look beyond the abstract when you look at studies. There are a lot of quote-unquote positive studies that were really poorly done. When you dig in and you really look at the study, they're not good, and anecdotes are not data. High-quality clinical studies have not demonstrated efficacy of ivermectin in treating COVID-19. A troubling issue is that recently online influencers have been touting the use of ivermectin to treat cancer and a number of other medical problems. There is ongoing research into ivermectin in treating cancer, but there's no evidence yet that it cures cancer in humans. This is not an issue of censorship. It's simply subjecting these studies to the same robust analysis that we have to give to any other study. Ivermectin does have some side effects. It is fairly safe, but it can interact with other medications, especially blood thinners. In large doses, it can be toxic. The biggest risk is that of patients using ivermectin and foregoing proven therapies. That can lead to progression of their underlying disease, and that's particularly a problem in cancer, which may be curable early, but incurable late if you've been treating it with ivermectin instead of getting the appropriate care. So again, it's not to say that ivermectin is not a good drug. It's a great drug. It's excellent in the treatment of parasitic worms, but its efficacy in COVID, cancer, and a host of other maladies is simply not proven. Permitting a pharmacist to dispense a medication by standing order requires a well-evaluated protocol established through a broad consensus of providers and pharmacists using the best available evidence, not anecdotes. A broad consensus supporting the use of ivermectin in COVID-19 or cancer or anything other than parasites does not exist. Governor Sununu's veto message on 1022 stated, quote, "The state currently has only 4 instances in which pharmacists can dispense medication without a prescription. These medications are smoking cessation, contraception, substance use disorder, and treatment for sexual assault, all of which have gone through rigorous reviews and vetting to ensure they meet all the necessary protocols prior to a medication being dispensed via standing order. All drugs and medications should be subject to the same rigorous process if they are to be dispensed by standing order," end quote. And as he pointed out, ivermectin can be prescribed off-label by a provider. Off-label prescribing is common. The FDA states, quote, "Healthcare professionals may choose to prescribe an approved human drug for an unapproved use when they judge that the unapproved use is medically appropriate for the individual patient," end quote. You can do it. Providers are free to prescribe off-label. I did that. But they do need to follow the best evidence in doing so, and they have to have a patient-provider relationship. Standing orders of pharmacists should not be used to dispense medications or indications that are not clearly supported by the best available medical evidence. Ivermectin, does not reach this level of evidence for anything other than parasites, and providers already routinely prescribe it for that indication. It's easy to access for the appropriate use. Online influencers' recommendations do not represent best available evidence. So please vote no on this amendment and let the underlying bill, which is important, get passed. And I'd be glad to take any questions.
Thank you. Any questions? Seeing none. Thank you.
All right, thank you.
Also signed up to speak is Caitlin Como from the New Hampshire Pharmacists.
Good afternoon, Chairman McDonald and members of the committee. My name is Caitlin Como. I am a practicing pharmacist in the state of New Hampshire. I've been a lifelong resident and practicing for 10 years. I'm also here representing New Hampshire Pharmacists Association in opposition of this amendment. For those who are not familiar, one of the core functions of a pharmacist is to ensure that patients receive safe and appropriate prescription medications. I consider us to be sort of a quality assurance department of the medication use process. So we assess prescriptions for the correct dose, route, frequency, clear instructions for the patient, relevant drug-drug interactions, and side effects. We also provide patient counseling on how to safely administer the medication. But unfortunately, pharmacists do not always have access to a patient's full medical history, which is critical to ensuring safe medication use. And we rely on providers, prescribers, doctors, nurse practitioners to send appropriate prescriptions knowing the patient's full medical history. As some of the others have testified, there are currently only 4 situations in current statute that allow for a standing order to be used in the place of a prescription, and this is the exception, not the rule, to medication use. While standing orders can be an effective means of increasing access to medications, the benefit is really dependent on therapy-specific training by the dispensing pharmacists. We're not prescribers by our own training, so in order for an effective standing order to be in place, we need proper training. The proposed amendment to this bill does not establish such a training requirement, which is outlined in some of the other standing orders in our state. It also does not establish rulemaking authority for the Board of Pharmacy that would help ensure that adequate training is in place for pharmacists. I wanted to highlight a concern in regards to how this may affect frontline pharmacists. I anticipate that this could cause some potential conflict and tension between a pharmacist and a patient if an individual pharmacist chooses not to dispense the medication or not to implement the standing order. In my experience, community pharmacists are chronically overworked and understaffed. Ivermectin use has become a controversial topic, and a standing order such as this would have the potential to add significant burden to an already stressful workplace. So I'm advocating on behalf of the pharmacists in New Hampshire against this amendment. I truly believe that patients and pharmacists would both be best served by obtaining access to ivermectin through the safe and lawful channels that we currently have. I have nothing to say against the medication's efficacy. I think you've heard that it does have its role in therapy, but the smartest option is to have a patient and provider conversation about the use of that medication first prior to obtaining that medication. And I'd be happy to take any questions. Thank you.
Perfect timing. Representative McGrath, who is a pharmacist.
Yes.
Hi, how are you? Thanks for taking my question, and thank you, Mr. Chair. So this bill has 2 parts. We're looking at the amendment.
Mm-hmm.
The second part of the bill, which I have a problem with because of some of the things that you've said, is that the chief medical officer can put in standing orders for over-the-counter medicines, medical supplies, and laboratory tests. And how would that affect the pharmacy business?
I just want to clarify for the committee the difference between a standing order and an over-the-counter medication, just for some clarity. A standing order, as you allude to, requires that there's a provider that signs a piece of paper with a clear protocol for a pharmacist to dispense something, either a supply or a medication. An over-the-counter medication by itself is not regulated the same as a legend drug, as Dr. Ballard mentioned. But I don't know in terms of the other pieces of the original bill. I'm not sure exactly how that will impact pharmacy. From my experience, the volume of prescriptions that we dispense based on a standing order is very low. I anticipate that with I anticipate that with this amendment in relation to ivermectin, we would see potentially a significant increase in people seeking access to that. But again, I stand by my original statements. I think the best course of action is to have a conversation with your doctor about appropriate use of this antibiotic. Thank you. Did I answer your question?
Sure. So the second part of the bill, the standing orders would be so that Medicaid patients can just come in and get over-the-counter meds on a standing order, so the volume would be very high. Okay. So again, how would that affect the retail pharmacy business?
That would certainly cause an increase in workload for pharmacists. Patients can grab over-the-counter medications off the shelf and don't need consultation with a pharmacist, but the process that happens if they're seeking a medication via standing order to be paid by Medicaid would be that they come to the counter at the pharmacy. They ask the pharmacist to enter an order on their behalf, which takes time. The pharmacist has to process that, cross-reference their medical record, their drug list, count the medication, label the medication, provide counseling. So yeah, it certainly would add some burden and time to pharmacists and their workload.
Representative DeLamus and then Representative Weber.
Thank you, Mr. Chairman. So, first of all, you said that ivermectin is an antibiotic. Is ivermectin an antibiotic?
I'm using the term antibiotic as a broad umbrella term to encompass all anti-infectives. I should have used the word anti-infective.
Okay, thank you.
Follow-up.
Follow-up, yes, thank you, Mr. Chairman. There are other drugs that are introduced onto the market that have a high efficacy, and you may need to take training to learn about them. Now, the standing order, you said, if or an official with your standing order has to write out the procedure on a piece of paper, is that posted in the pharmacy, or how do you know about a standing order?
Typically, the pharmacy, if they've elected to opt into a standing order, would have that piece of paper on file in some filing cabinet and, if required by statute, a training plan in place. So an example that somebody brought up was the oral contraceptives. So I am not an expert in prescribing the correct dose of oral contraceptives to patients. There are probably 50 different variations of that medication. But if I took an accredited course on selecting the correct dose for a patient based on a number of factors, weight, age, what they're using it for, whether it be, acne or other for contraception itself, then I might be qualified to help them choose the correct dose for their indication. But, without having clear guidance on what this medication is being used for, there's a variety of indications for it. It'd be difficult, I think, to have one standing order that would cover all of the uses of the medication.
Hello.
Thank you. So there have been 3.7 billion doses around the world that have been administered to people. And there's probably a very large file of how this particular drug interacts. And if a doctor or whoever writes a standing order, don't you think you'd be able to handle that? I mean, even if you have to have special training, what if it wasn't ivermectin? What if it was pectamycin or something, and it cured cancer? And all of a sudden, we had a standing order for this particular drug, a hypothetical drug. Wouldn't you be willing to take the testing and the course necessary in order to fulfill the standing order for the betterment of the people in the population who might need it?
Some pharmacists may be willing to do that. A lot of this comes down to our training. We are not prescribers, we're not diagnosticians, so pharmacists are trained in better understanding of medications, interactions, dosing, things like that. So it's outside of our traditional scope to be using a standing order. So it does require that additional training. So I think some pharmacists in the state may be interested in that, but as I mentioned in my testimony, pharmacists are overworked, stressed. This may be something that is really low priority for them based on the additional workload that they already have. So asking a pharmacist to be prepared for patients to come to the counter and demand this medication, I think is challenging for my profession.
Thank you.
Representative Weber.
Thank you. I just wanted a clarification. If a standing order was issued under this, as it's currently written, would a pharmacist be required to dispense ivermectin, or would they be able to choose whether they want to undergo that or not?
In my experience, that's a choice that's made. As I alluded to the oral contraceptive standing order, not all pharmacists are trained and do not opt in to provide oral contraceptives to every patient that would ask for it. I think it really, again, I'm going to reiterate the workload that a lot of pharmacists would probably have trouble if they weren't well trained in this particular standing order. They'd have difficulty, dealing with members of the public who are expecting for it to be available to them.
Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. So how would this vary for the information that a pharmacist would have to give to somebody that's not even a prescription, but over the counter, if I were to say, come in and ask you for questions about NSAIDs or something along those lines? Let's say I have an allergic reaction to it or something like that. How would that differ from what Ivermectin conversation would be?
So I'll try to give an example. So if you came up to the counter of the pharmacy and asked me questions, typically if I didn't know the answer, I could consult a reference to be able to provide you evidence-based information about that. My understanding of a standing order would require that it's a deeper conversation that you have with the patient. What's been going on? What are your symptoms? How long has this been happening? What have you tried so far? Have you spoken to your physician about this? It's a lot more of an in-depth conversation, my guess, outside of just a quick consultation with a pharmacist about what's the best medication for lice treatment or something like that. Does that answer your question?
Follow up?
So I guess to expand on that is what I'm looking for is specific things that you might have to do differently. Like, I mean, when it's over the counter, if this were passed to be over the counter, then you would have to have a parameter, right? Because, I mean, obviously, if you're allergic to NSAID or if you have a question and you're asking about its prescription, over the counter, you're going to have different parameters. I mean, I'm sure that there's policies in place for those companies that might not be able to give you that information. Is that correct, too, I guess? I don't know that I'm following your question. I'm sorry. Let me rephrase.
Sure.
Is there any reason that a pharmacist would not be able to give you information on ivermectin if it was over the counter?
No, probably not. I mean, our standard would be we could provide information on, recommended dosing for a particular indication, side effects, interactions, things like that. But, again, selecting the appropriate dose based on the indication when we're not diagnosticians, we can't diagnose, is not within our scope typically. So that would be a different conversation. Yes.
Representative McLean.
Yeah, just quickly. So a standard order like this, who would write it? Does the chief medical officer of the state write it and it goes out to everybody in the state and it's one universal standing order for the whole state? Or would each pharmacy reach out to it? Logistically, how does that work?
I think I've seen both. So I've seen situations where there's a statewide standing order, for example, naloxone, where the chief medical officer for the state does sign that, and any pharmacy can take advantage of that. I would anticipate that this would be a standing order that we would need a physician or a provider with that licensure to opt in to be the signatory on every order that's dispensed for ivermectin.
And that would be for your chain. So CVS might have its doctor and...
Correct.
Thanks.
Anyone else? Seeing no one else. Thank you.
Thank you.
Also signed up to speak is Maura Weston from the New Hampshire Medical Society.
Good afternoon, Chairman McDonald, members of the committee. For the record, my name is Maura Weston, and I am here today on behalf of the New Hampshire Medical Society. I am here today in opposition to the amendment before you on behalf of our 2,000 plus physician and medical student members who live in and treat patients in New Hampshire. We are opposed. The primary mission of the Medical Society is to advocate for and promote public health issues that impact patients. The patient-provider relationship is of utmost importance to our members. We're opposed to this amendment because it singles out a specific medication in statute and sets a precedent legislating prescribing practices. With over 23,000 FDA-approved medications, we believe it does not make sense to legislate medicine. Few physicians would endorse delegating the prescribing of ivermectin to pharmacists. We rely on the importance of the patient-provider relationship and appropriate prescribing practices based on medical history and conditions. With that, we urge you to recommend this amendment inexpedient to legislate and maintain the integrity of the underlying bill. And I'm happy to answer questions if I can.
Thank you.
Thank you.
Representative McLean.
Thank you, Mr. Chair, and thank you for taking my question. Sure. We heard testimony that ivermectin is a safe drug, and the debate is over how it should be dispensed. And there are, though, we heard cases from the pharmacists where we do have standing orders in place. So what is it about those things for which we have standard orders in place currently versus ivermectin that you would think makes them good candidates for standard orders versus the ivermectin, which is a safe drug, not be a good candidate for the standard order?
Sure. Thank you for the question. I will be perfectly upfront that I am not a physician, so I may not be best qualified. However, it's my understanding, generally speaking, that in cases where there are standing orders, those orders are there because of emergent circumstances. For example, naloxone, that's one with which I am familiar. And so I would suggest that there's a different standard in the case of those standing orders, and that in this case, we would prefer to rely on that conversation between the patient and the provider.
Well, and just forgive my ignorance. You mentioned that you're familiar with the naloxone case. I am not. So maybe it might educate me a little bit to say what was the condition that said this is something that should have a standing order?
Again, I think that might be a better question for DHHS or state officials. I'm not a doctor, and really my perspective on that is from the perspective of a layperson.
Representative Palmer?
So naloxone is for drug overdose. So if you wait to get a prescription, the person's going to be dead.
So it needs to be done.
Yeah.
Anyone else? Any other questions? Seeing no other questions, thank you.
Thank you for your time.
No one else has signed up to testify on this amendment to SB 119FN. Does anyone else wish to testify?
Just literally two statements, real quick.
Well, it's unusual for anyone to speak twice.
Representative Weber's question, real quick.
Well, you can speak to it. We can speak after. That's fine. We usually don't let anybody speak more than once. I'm sorry. Anyone who has not yet testified, does anyone wish to testify? Seeing none, I am going to close this public hearing on this amendment. No other legislation is before us today, so that concludes our business. We will be reconvening next Wednesday morning at 9:30 a.m. and be hearing other Senate bills. With that, we are adjourned. Thank you.